Let's get more now from France 24's Fernande Van Tets, who's keeping an eye on events there in Amsterdam, which is, of course, the home of the EMA. Fernande, your thoughts on what we've been hearing so far?
Well, this is quite a surprise, Tom, because for the past few weeks, the EMA has been very clear in its messaging that it was only very possible that there was this link, but actually they dismissed it mostly out of hand. I mean, the press conferences the past few weeks have been very clear in that that basically there was no link. As late last week, that is still what the line was. Now, of course, that was already breached yesterday when the head of vaccination strategy, Marco Cavalieri, told an Italian newspaper that there was a possible link. But the European press office, as early as yesterday, still sent me an email saying that that was personal remarks made by him. Now, of course, they're still hammering that message home that the risk-benefit analysis still says that you should be taking it. The Pharmacovigilance Risk Assessment Committee, which is the committee that evaluates the safety of medicines for the EMA, they have always said that that is their priority. You have to weigh the risks against the benefits. And because so many people are dying of COVID and getting sick from COVID, they still think that taking this vaccine, even with this very small risk attached, definitely outweighs the risk of not having this vaccine available and many more people getting infected.
Yeah, indeed. So AstraZeneca saying it's a very rare side effect based on the evidence they've seen so far. And Fernande, I mean, this is going to create a bit of confusion, isn't it? Because a lot of countries, including where you are, the Netherlands, have already taken matters into their own hands with regards to its handling and its policy towards this vaccine.
Indeed, Holland and also Germany basically stopped using the AstraZeneca vaccination for people under 60. Now, Health Minister Hugo de Jonge today put out a statement on Facebook saying that was a very limited number of people that were affected by that decision because only health professionals under 60 have been receiving the AstraZeneca vaccine. Here in Holland, they've been using it mostly for the at-risk population, which is over 60 years old. But yeah, they've stopped using it. It was a moment to pause, they said, after 5 women here did have blood clotting after receiving that vaccination out of 400,000 vaccinations that have been given here, and 1 person died. Now, ironically, Hugo de Jonge says the reason that they put this pause in place was to increase confidence in the vaccine. He said people wanted to be sure that when they took the vaccine that it wouldn't be causing any complications. Now, of course, this EMA ruling puts that into question, and they were waiting for this. Everyone was waiting for this with the idea that that would be the moment to possibly put AstraZeneca back into use. The health authorities here say they will take until tomorrow to figure out if they will keep using AstraZeneca for people under 60. But it's really putting everything back in play.
OK, well, thank you very much indeed for bringing us up to speed